Welcome to everyone. My name is Arlene Wallace. I'm the program manager for the African American Health Program from the Department of Health and Human Services in Montgomery County. I do want to thank those of you who are participating by phone as well as Zoom for joining us tonight on this very important discussion. Hey, Dr. Kroll, I do commend you because I know you're taking on and leading the department at a very difficult time. I do want to acknowledge two of the co-sponsors who have supported us in putting together this town hall meeting. Councilmember Craig Rice, who has been very supportive of DHS over the years, as well as the African American Health Program, and Councilmember Will Jawando. I do acknowledge and give thanks to all of the panelists who have joined us tonight, and there will be a time in which Tiffany will direct you and give you a chance to say a few moments about yourself. I do want to acknowledge that the department has been funding the African American Health Program for a number of years, and we have been focusing on the diabetes, high blood pressure, cardiovascular disease, and cancer, and more. And I found it very important because these are a lot of the underlying type of illnesses that have been contributing to numbers, and I should say probably thousands of deaths, and who knows how many hospitalizations related to COVID-19. And without having someone such as Tiffany Ward, who is our Chief Equity Officer for Montgomery County, who accepted this invitation with her busy schedule, tonight just wouldn't be possible. So I do want to thank Tiffany and then really just turn the moderation of this panel discussion over to her. Thank you, Tiffany.
Thank you, Arlie. Thank you so much. Good evening, all. I'm Tiffany Ward. I'm the Chief Equity Officer here in Montgomery County. I'll be leading this conversation. We are really lucky to have a talented and very busy group of leaders with us today to talk about COVID-19 in the African American population in the nation and, of course, here in Montgomery County. Tonight, we have with us Dr. Travis Gales. Dr. Gales is the Public Health Officer here in Montgomery County, as well as the Chief of Public Health Services here. We have Dr. Georges Benjamin. He is the Executive Director for the American Public Health Association. We also have Dr. Elaine Bonner-Tompkins. She is a Senior Legislative Analyst for the Office of Legislative Oversight here in the county. And we have Dr. Keisha Ford, President of the Black Ministers Conference here in Montgomery County. And of course, we have two council members, Councilmember Will Jawando here and Councilmember Craig Rice, to talk to us about COVID-19 and its impacts on our community. We are going to open the conversation with a few remarks from our council members. Councilmember Jawando, would you open us up, please? You're on mute. Will, unmute yourself.
Thank you. Yes, happy to do it. Gotten some feedback from somebody.
Maybe everybody can mute their phone.
Yeah, go on mute if you're on. It's okay. It happens to the best of us. Thank you for hosting this event. It's a very important event and one that I've been looking forward to. And I want to thank Arlie Wallace, Ms. Wallace, and the entire organizing team on AAHP for putting this together, because this is we're in some serious dire times, and we know that the old adage that when America has a cold, Black folks have the flu, and that is certainly true right now. No pun intended, as far as the respiratory, the virus that we're dealing with. This is about life and death in our community. And I'm very proud to be working with my colleagues, particularly my friend and colleague, Councilmember Rice, who you'll hear from shortly, to address this in every aspect that we can as public servants. As an at-large council member, I have the honor of representing every person, every neighborhood, and every district in our great county. As you can imagine, with the county as diverse as Montgomery County, what I see varies from place to place. I grew up in Long Branch, in an area of Silver Spring that's mostly immigrant, between Black and Latino and African immigrant, very low income area. And growing up, I saw these disparities firsthand. And I continue to see him now as a resident of the eastern part of our county, where a lot of our African-American community live. And in one of the top 2 zip codes, depending on the day, 20904, where we have the highest incidence of cases of COVID in the state of Maryland. So I'm very aware of how geography places and how your race impacts your outcomes here in the county and in the country and in the world. Several weeks ago, the alarming statistics came out that we all feared, that African Americans are dying at the highest rate of any other group in the United States of the COVID-19 virus. This highlights, as we know, long-standing disparities in health and inequality and access to medical care, as well as underlying health conditions. Shortly after we saw some of this data nationally, some places like Chicago, where 70% of the deaths were African American, for example, the county council sent a letter to Governor Hogan requesting racial data, a breakdown of the number of cases and deaths related to COVID-19, in order for us to better protect and serve our residents. We also asked for them to provide data by age and gender, and to direct the Maryland Department of Health to collect this information and report it to us on a daily basis. I'm glad to report that that is now happening. Every day we get information on the breakdown, the zip codes, the race and ethnicity, though it's not perfect, and I'm sure Dr. Gales and others will speak to that, of folks who have been infected and have passed away. I want to raise something that we don't get, and this is going to come up more in coming days, and I think this is something we need to be aware of. We knew our data was going to be in line with, probably similar to the rest of the country, which it is, where we have the highest number, African Americans have the highest number of cases and the highest number of deaths. And in the area of cases, it's almost double, several thousand more as far as diagnosis. The deaths are closer. But last week, Johns Hopkins, and I encourage everyone to look at this, published a new map on its website, on its resource site, showing which states have publicly broken down their statistics by race. Most states, I think about 38 or 40 of them, have begun to do so, like Maryland has recently, and are providing information based on race for deaths from the disease. But only 2 states, Illinois and Kansas, are reporting on another very important piece of data: who is getting tested for this disease. And that's something that I can't answer the question tonight. Maybe Dr. Gales and others can, but we know that disproportionately, even though we're disproportionately dying and are infected, we don't have much of a sense of who's getting tested. Is that proportionate to our population? We know we're segregated in our county and in our state and in our country largely. In those pockets, are we getting the amount of testing that we need in those areas? So this is something that I'm very interested in. We're going to be raising with my colleagues and as we try to address this issue. We also know that from the World Health Organization and our own health officer, that those with pre-existing conditions like asthma and chronic lung disorders, diabetes, heart disease, appear to develop more serious illnesses and don't do as well with COVID. Obviously, this impacts us in a dramatic way because of environmental, societal, and economic factors. Of course, institutional and systemic racism and lack of investment in our communities has made our outcomes worse and our access to health care worse. So tonight, we're going to talk about these issues in a very serious way, but I wanted you to hear from me and from all of us that we're committed to addressing these issues. We're working on strategies. Every day, we're talking about how do we get testing, get care, get funding where necessary, and resources to our community, as we try to help in this crisis for every one of our residents. So I look forward to the discussion, and I appreciate AAHP for having this again. Thank you.
Thank you so much, Councilmember Jawando. I'm going to ask all of our panelists to just give us a few words about why this conversation is so important to have, particularly in our community. So if you would just say a few words before we start our questions, I'd appreciate that. And I will go to Dr. Gales.
Good evening, everyone. And sorry we have to meet under these circumstances, but looking at the experts on the panel, and I have to say a special word of, as one of my role models, Dr. Benjamin, and the work that he's done over his career and continues to do with the American Public Health Association, we're in good hands. This is an important conversation because anytime we're talking about public health issues or pandemics or epidemics or outbreaks, it's important to talk about how that impacts all of us. But when we have data that shows it disproportionately impacts certain communities, that this is not anything new to us who have been doing the work, because the same things that are predisposing folks to having worse outcomes are the same things that we've been talking about for decades in terms of disparities. Whether you call it health disparities or social determinants or inequities or inequalities, the facts have stayed the same. When we look across infant mortality, when we look at cardiovascular deaths, when we look at diabetes rates, the numbers have been consistent. And I'm hopeful that, I'm sorry that COVID-19 is potentially what it's taking for us to have even a more substantive conversation to create the kind of systemic change to address those contributing factors so that, God forbid, we're talking COVID-26 or COVID-35, we're not looking at the same disproportionate outcomes based upon the same inequalities that have been plaguing our communities for years.
Thank you, Dr. Gales. Dr. Benjamin, do you have a few words for us before we start our questioning?
Sure. Good evening, everyone. I spent the first half of my career practicing clinical medicine, and for some of you know, practicing emergency medicine here in this county. And then I've spent the last half of my career, of course, to date, practicing public health. And one of the things that I learned is that attention to detail matters, science matters, and public health matters. The public health system is tragically invisible to most of us until something bad happens, and then we need it. And prevention will probably, one could argue that there are some preventive things we could have done over in China to prevent this from happening. But we do know that prevention and a robust public health system is probably one of the many, many pieces of the solution to getting us there. But it requires a workforce, well-trained, engaged. It requires adequate testing. It requires adequate data technology and infrastructure. And it provides, the need for leadership. Now, the good news is our county and our state has good leadership, and we have a profoundly good both county and state health department. And so I think we there are ways we can deal with this. We do know that our county is disproportionately impacted for a variety of things, and I will get to talk about that tonight and some of those solutions. Thank you.
Thank you so much. Dr. Ford, if you're able to give us a few words before we start, I'd appreciate it.
Okay. Good evening, everyone. I am grateful and thankful for the invitation to be a part of this great panel. I am the current president of Black Ministers Conference in Montgomery County, Maryland. I'm proud of that group. This is a very compassionate group, a group of pastors of congregations who are living throughout Montgomery County, Upper County, Mid County, Lower County. It consists of all of the spiritual leaders of those churches. And obviously in this season, along with you, the community leaders and political leaders, we have information that is necessary for the vitality of our people, and that our job is to assist in disseminating information and to make sure that it gets to our people, not just in our congregations, but also in the community. And so I'm happy to have Reverend Nelson. Kenneth Nelson is also with us on the call. As you can see the block on the screen, he is also on behalf of the Black Ministers Conference. And so we have seen this COVID-19 have affected, has come very close within the church. It has come nigh to pastors, not just parishioners and not just the people in the community. Pastors have, some have been sick, and our parishioners have been sick, and people in the community and family members and loved ones have been sick. So it is important that we are continue to have forums like this where we can give information that will help in the process while we're trying to weed our way through this maze at this time. And so I'm glad that we're here having this conversation. Hope to have more.
Thank you so much. Dr. Bonner-Tompkins, if you would bless us with a few words, I'd appreciate that as well.
Sure. Good evening. Hello, everyone on the panel as well as our participants. My name is Elaine Bonner-Tompkins. I work for the Office of Legislative Oversight, which serves as the research arm for the County Council. I applaud AAHP for having this forum tonight. I think it's crucially important to have this discussion and engage the community around the disproportionate impact of COVID-19 on African Americans. I think that this, one of the reasons why this panel is important from my perspective is that it helps to implement the county councils as well as the executive branch's vision of including the community as part of the discussion and helping to inform the county's decision making. We know that racial equity and social justice are not, really are the drivers of the COVID crisis. Any policy area you look at, there are wide disparities by race and ethnicity in terms of outcomes. And we also know that really it's a function of structural barriers. It's not a function of differences in individual behavior by group. We also know that really to move past these inequities and to identify and scale up solutions that will reduce the inequities, it's incumbent that we engage with communities of color who are disproportionately impacted by these disparities. And so I'm excited about the conversation that's going to occur. And I'm excited about having this platform and hopefully using it as a framework to tackle the other disparities that impact our county and impact this country at large. So thank you.
Thank you. Thank you. Last but not least, Councilmember Rice, I see you got on a...
I did, and thank you very much. It's been a crazy whirlwind of a day, and so Councilmember Joando and I think we've been on together since about 9:30 this morning. I was actually on a conference call at 8 o'clock this morning. So look, here's where I stand, and this is something that I said to Dr. Gales this morning. We've got to get aggressive about making sure that we look at doing testing in our communities of color. That should be a priority for us. We know that when a group of people is more at risk, you want to do as much prevention as possible. And so we don't want to be reactive. We don't want to say, okay, well, we'll do triage and treatment afterwards. We have to focus our efforts. And so when we look at the zip codes to where we see this happening in our Black and brown communities, we know all too well, of course, that's going to be the case. But guess what? That's only with a small amount of testing. And that's with testing only going to certain groups of people. So the reality is that it's probably a lot worse than the numbers that we're showing because a lot of our folks don't have access to the test. And so from that perspective, I think if we're serious about erasing some of the disparity we see in terms of the risk of what's happening with COVID and how it's exacerbated by the current conditions that we have, we've got to get aggressive about this. And so from that perspective, I'm really happy that Dr. Gales is on and others in our health field to kind of give us some of the best practices. But for me and where I stand, and I know where Councilmember Joando stands, we've been talking about this. We're ready to put forth the money and put forth the initiative where it needs to be, because it's very clear that this can only get worse. It's not going to get better.
Thank you, Councilmember Rice. We also have our head of HHS here with us, Dr. Raymond Krall. And I want to give him an opportunity to say a few words if he would like. Don't feel pressured, Dr. Carl. We do have a few questions for you in the discussion, but if you would like to give us a few words, we'd appreciate it.
So good evening, everyone. Thank you, Tiffany. I appreciate it. And thank you all, Councilmember Rice, AAHP, Councilmember Jawando, for taking the time to do this. This is important, and it's important to me on a number of levels. I think there's a challenge here around testing, and there are a lot of fears about this that we have to address tonight. But one of the things that we're trying to do, I think, in this is to begin this process of educating ourselves and educating the Black community about the truth and the realities and the mythology of COVID-19. We are resilient people by nature, and we're very proud of that resilience. But I think sometimes we need to understand that pride can delay us from getting the help we need or for understanding our vulnerabilities. And so I want us to understand what those risks are and for us to take advantage of those things. I think take advantage of the resources that are there. I think Dr. Mitchell's comment about access to testing as opposed to just the data about the positive test results, that is an important distinction that we need to understand, that it is about equity and access. It has always been about equity and access. And I think even more so now, we need to be focused on that.
Thank you, sir. I want to thank all of you for your opening remarks, and we're going to dive into these questions. We have quite a few and about an hour to get through them. I'm going to start off with some science-based questions, and I think the first question will go to Dr. Gales. Dr. Gales, what exactly is COVID-19, and why has this become a pandemic for the world?
Sure. So COVID-19 is a virus that's a part of the coronavirus family. The coronavirus family encompasses a whole lot of different viruses, including the common cold. The common cold is a coronavirus. But COVID-19 it's been named that. It's a new strain, a novel strain. You've heard it called novel COVID-19. And so it is a virus that causes wreaks a lot of havoc and damage in the lungs and the respiratory tracts. And what it does is it gets in and it interferes with the particular units of your lung that are responsible for oxygen and breathing, and that's breathing and oxygen is important to life. And what happens is it can cause a lot of inflammation in the body that makes it very difficult to breathe and to carry on your regular daily life responses. And it's become a pandemic because it spreads so easily. And that's the biggest challenge is it spreads very easily. It can live on surfaces for a while. We now know, science has shown us that it can be transmitted to others when you are asymptomatic. And that's concerning because there are a fair amount of people who are walking around without symptoms. And so there's a few challenges from the science that have made it a pandemic. There are other contributing factors such as, politics. When we're talking about testing access, if you think back to the very beginning, there were very tight restrictions on who met the criteria to be tested. There was very limited supply of test kits. There's still very limited supplies of test kits. And so there's a lot of other factors that have created the environment making it easy to spread. And unfortunately, because of that, the responses that we're trying to do in some ways may look like we're being reactive, but in many ways we have to be because we're a couple of weeks behind. We're trying to catch up due to that lack of large-scale testing and the fact that we weren't testing everybody in the very beginning. And so as we have found out more information, we have tried to be very proactive, even if we're reacting to new data, to make sure that we have put in provisions and policies that are responding very quickly to the new information. So in summary, a virus that's part of a family that we've been exposed to for a while, but a new strain, and that is easy to spread, and the complicated politics and issues around access have made it spread easier to where it is today.
Thank you for that. I guess my second question will be for Dr. Benjamin. Dr. Benjamin, when the CDC first started to talk to us about COVID-19, they said that the co-occurring diseases worsens the prognosis for someone who contracts COVID-19. Would you tell us what those co-occurring diseases are and why they make African Americans more vulnerable to contracting and possibly dying from COVID-19?
Thank you. The early data that came out of China showed that people who are older, meaning older than the age of 60, who had chronic diseases such as lung disease, diabetes, hypertension, and heart disease, particularly congestive heart failure, were more at risk of getting sicker and dying should they get the coronavirus. And of course, everybody looked at that and said, why? That's a problem, because we know that in the African American community in particular, also in the Hispanic community, we disproportionately have those diseases. And so most of us, of course, said, we need to watch for this to see if this is going to also play out here in the United States. Now, the more interesting thing I don't think a lot of us really thought about right off the bat was the fact that 45 is the new 60 when it comes to people of color. And that's because not only do we have those diseases, but we have those diseases at a younger age. So the early messaging was around, you had to be older, you had to have these chronic diseases. Unfortunately, a lot of people heard that to mean, if I'm young, I won't have a problem. Well, it also turned out that there was at least some early evidence that young people seem to do better, not immune by any means. And with that, people seemed surprised when they saw the disparities, but they were highly predictable based on this. When we had H1N1 came, which was another viral disease, actually that was a kind of influenza virus, we saw these disparities then. And we have always seen this anytime a new disease enters the community. So, we kind of knew this was coming. I don't think anybody thought the disparity would be this broad, nor that it would be this worse.
Thank you. And now that we've talked, I guess, a little bit about the health reasons that African Americans are vulnerable, I want to talk a little bit about the social determinants of health. We've been hearing that term used when we're talking about COVID-19 or coronavirus. Dr. Elaine Bonner-Tompkins, could you tell us about, well, one, what social determinants of health are, and why we are, when I say we, African Americans, more vulnerable because of these social determinants?
Sure. So I'm going to refer to, as I think Dr. Gales and someone else mentioned, there's a lot of different definitions of social determinants. And so I'm just going to refer to the CDC's definition and then talk a bit more about that. So the CDC defines social determinants of health as life-enhancing resources such as food, supply, housing, economic and social relationships, transportation, education, and healthcare, whose distribution across populations determines the length and quality of life. And so I'll defer to Dr. Gales to talk about the differences in life expectancy by race in the county. But needless to say, we know that there's a gap that's probably a decade or more between our more affluent white and Asian residents versus Black, Latino, and low-income residents in the county. And a lot of that is shaped by the different life experiences reflected by the social determinants of health. And so, oftentimes there's a perception in the county, not among this panel, but just folks in general might think that, Montgomery County is affluent, you have to have resources to live here, and that really there isn't much of a disparity in social determinants in the county. There's obviously more recognition that that's not the case with sort of the distinctions between East County and West County, and understanding the higher concentration of COVID cases and just disparities in general in certain zip codes in the county. But the county council last year, requested OLO to do a report, a commission report that provided racial equity profile for Montgomery County. So it looks really, it overlaps very well with the social determinants of health to really describe how there are disparities in these factors that shape access to healthcare, that shape health outcomes. I had never heard of 45 being the new 60 for African Americans. That really saddens me, but that definitely is how the data plays out. And if there was another way to capture sort of these, in other policy areas to sort of talk about really sort of the black tax or the lower outcomes, the diminished outcomes that we tend to have is characteristic in other policy areas as well. And so if you look at, for example, median household income in 2017, for Black folks, the median household income was only about 60% of what the median household income was for white residents. So it was $72,000 versus $120,000. If you look at unemployment, Black unemployment has been double the rate of white unemployment in the county as well as across the state. That's probably gotten worse with this pandemic and the decline in the economy. If you look at access to healthcare, in terms of health insurance, again, you have higher rates among Black folks than white folks. If you look at educational achievement, again, gaps. If you look at poverty overall, as well as among children, vast disparities. And all of these experiences shape, create stress that results in health disparities as well as diminished access to healthcare resources. And so all of those are, sort of separate from the idea of biases in the healthcare system. And so there's just, it's not simply a matter of bad habits that explain these disparities. Although, there's a component of that to it, but it's not. I don't think, when you look at sort of what all the determinants are, I wouldn't say that that's the predominant. I don't think the research supports that either. So that gives you some context for what the social determinants of health are.
Thank you. Dr. Cole, are you interested in talking just a little bit about social determinants, or should I go on to the next question?
Well, just a couple of things that I might add to that. One of them, just from Montgomery County, that at present, approximately 60% of the population of homeless people in Montgomery County shelters are Black or African American at this point. It's a statement about preservation of wealth, ability to afford sustainable housing for folks, and access to sustainable housing, access to living wages in the county. Poverty is an overarching factor, even in Montgomery County, and is as wealthy as we are, and is often perceived to be. There is certainly, I spend a lot of time as a psychologist talking about stress and the impact of stress on the lives of folks, and stress on African Americans is equally, has another whole layer of dimension to it. The stress of racism, the stress of perception and misperception of implicit and explicit bias in our system. Issues of digital divides that put us behind the 8 ball from the beginning. Not to mention that there's limited access to insurance and healthcare, but even if you have that, there's limited access to physicians, to primary care docs when you need them. We have, even in Montgomery County, food, I wouldn't call them deserts, but the food options get dramatically limited in terms of what's available, the quality of what's available, and so your nutrition is off. And when you do have, when you're faced with limited resources, your choices that you're forced to make and what you compromise on can lead you down to health choices, nutrition choices that aren't necessarily the best thing for us. So all that kind of compiles, and it is additive to lead us to set us up for being vulnerable to a lot of different healthcare problems.
Thank you. That was a good add-on. Those are all really important to understand and to keep in mind when thinking about how and why health disparities weigh heavier on us than our counterparts. I'm going to give the council members a chance to speak really quickly about what's been done, I guess, since this COVID-19 crisis has started. Since it started, we know that there's been a bunch of appropriations, a bunch of bills that have been introduced and passed to try to mitigate some of the social determinants of this health crisis. and particularly around disparities. So if Councilmember Juando or Councilmember Rice want to talk about what the council is currently doing or has done to try to mitigate some of these social determinants to help some of our suffering residents, I'd appreciate that. You want to go first, Craig?
Sure. I'll just go ahead and jump in because I have something that I started with that I want to talk about, which is about food and food access. We all know that a large number of the children that are in our schools are food insecure, and those families, when this COVID crisis hit, one of the first things I knew right away is folks aren't going to be able to feed themselves or their children. And so we need to make sure we were stepping that up. And so I was very happy to partner with folks on the council to make that happen, giving MANA additional food and additional dollars to buy weekend backpacks, Women Who Care Ministries in Montgomery Village in the Gaithersburg area, really making sure that we knew that that's a part of it. Stable housing and stable food are some of the things that we know when you want to talk about stressors that like Dr. Kroll was talking about. That's what it is. Can you stay in your homes? And I'm gonna let Will talk about that one. And can you put food on your table to put food in your stomachs? And that it's healthy food also, right? Because again, the go-to, it's easy when the grocery stores are empty and the shelves are bare to go to McDonald's because it's still cheaper, right? Than sometimes having to pay for some of the high-priced items that are there. And I will just tell you one of the things that a lot of folks have tried to say isn't true, but it is, because I actually do some of the shopping in our household, is that grocery prices for some produce and things like that have gone up. Those prices have gone up from what they used to be. And so I'm paying attention to that and realizing, well, wait, so healthier options are not there and not as affordable as they were just a month and a half ago. And even then they were expensive. And so we doubled down. We have a new resolution that'll be coming out in terms of adding another appropriation of additional funds to support combating food insecurity. That'll be another $750,000, $750,000 going to a lot of our partners and to ethnic grocery stores. So that means our African-owned stores that are in our Asian and our Latino stores that are in our communities, and making sure we're partnering with them to get food to those communities that need it most. Again, this is us trying to work together on that front. So I did want to talk about what we're doing on the food front, and of course, on what we've been doing since the pandemic started.
Thank you, Craig, Councilmember Rice, and he's exactly right. You know, today we voted on a bill that I introduced a couple of weeks ago to, the goal was to freeze rents so that there can be no rent increases during this crisis. It was amended against my will, but the legislative process played itself out, and now rent increases will be capped at the voluntary guidelines, which are 2.6%, which is much better than the 20 or 30% benefit. And that'll happen through 180 days after the state of emergency ends. So we voted that bill today. And the reason that's so important, we took action very early. We were the first in the state, along with, I think, Baltimore City, to stay evictions in Montgomery County, working with our sheriff and our great circuit court judge who oversees evictions. And then that happened statewide, and Governor Hogan did that. And that's the right thing. But that's for this period. And we need to make sure that people can, to the best that we can, and we can't do it all, we need federal and state help, afford their rent now and not have increases. And when we get out of this crisis and when the evictions moratorium is ended, we don't want to see, which I greatly worry about, a huge spike in people becoming homeless and being evicted. And so we need to be focused on that, to Councilmember Rice's point of people staying in their homes and feeling secure. I'm so glad Dr. Benjamin said that 45 is the new 60. It's not a great bumper sticker, but because it's sad, but you know, because you often hear the alternative, you know, girl, 50 is the new 30, right? You know, and so, you know, and I have a fly mother-in-law who's up, in 60 plus, but doesn't look it. And we all know those type of folks, and that's great. But we want to be the same internally as we are externally, And so, that's a serious issue. And when you look at rental housing, so the bill, this is why the bill we took action on today is so important. 55% of African Americans in Montgomery County spend more than a third of their income on rent. Just think about that. 55% spend more. If they have $1,000 a month, they're spending $300+ $350 or more on their. So what do you not have left? Money for food, money for transportation, money for education. So you make choices where you buy, because we subsidize all the wrong foods. I worked on Capitol Hill, and I constantly was fighting on the ag bill to change fruits and vegetables from specialty crops, which is what they're called now, to be called actually food that is healthy for you. And worked with Ms. Obama on Let's Move to change things in school lunches, and now they're rolling all that back, and now pizza is a vegetable again. So there's a lot of decisions that filter down. And there's two things I think that I want to just end with. We're trying to do everything we can to keep people in their homes, feed them. I was partnered with the Capital Area Food Bank and Kingdom Fellowship Church and the Recreation Department, and we gave 500 healthy grocery boxes to people last Saturday. We'll be doing that again this Saturday at the White Oak Recreation Center. I wanted to make sure I mentioned that. So if you're in need and you know people, send them, tell them to get there early. It's 11 a.m. And Dr. Gales, don't worry, we kept social distancing, and we did that right. But that food was gone in an hour, and we had to turn hundreds of people away. And so that money, Councilman Rice mentioned, for food security is so important. Two things we have to do. A crisis creates the opportunity for big change. It also exposes who we are, right? It's exposing and laying bare what we haven't done, all our warts, the things that we knew were there, these disparities, this report that Dr. Gales does and Dr. Benjamin, they've dedicated their lives to addressing. It's showing us in a horrible way who we are, and it's pointing the mirror right in us. So let's not lose the opportunity, both now and the immediate crisis, to address testing, to do what we need to do to get people resources, get people access to care, connect them with primary care physicians, and then let's do what we need to do on the back end of this crisis to keep those connections going and fund this disparity work and make sure we get the word out about why this is so important. I just have to underscore that point. If we get nothing else out of this, let's protect who we can right now, but let's make sure that coming out of this, everyone knows about these types of disparities that we need to address so that this doesn't happen to us in our community again.
Thank you. I agree. We can't lose this moment. I think health disparities is front and center in the nation. And it's time that we actually start to pay attention and actually do and put in some permanent solutions to these problems before there's another epidemic type of disease that comes through. Thank you. Dr.
Tiffany, you're on mute.
I'm sorry. Thank you. Dr. Ford, there have been several myths surrounding the African American community and the contraction of the COVID-19 virus. Will you speak to identifying some of these myths and talk to us a little bit about what you think can be done to dispel these myths?
Well, I think that we have mentioned a lot of some of the myths in the very beginning. That first of all, when the big boom came out about COVID-19, in particular in media, you didn't see Black folk, African American folk in the media. You didn't see that, which left people behind the scenes to have their conversations about who the disease is for and come up with conspiracy theories and why it's happening and all of those things. But what is sad about it is that we know that COVID-19 is not biased. There are many, as you heard the numbers this evening, that many of us have had to deal with it in some way, directly or indirectly. That it is not a Black disease, it's a white disease. We've heard things of that nature, and it is a sad situation because what it does is puts us in position to be behind the 8 ball when we really should be in a position to be responsive instead of reactive. I believe Councilman Jawando mentioned being not being reactive, that we need to move forward and be progressive as we are attacking just not only the disease, but the main thing is the education being disseminated in a rapid way to our people, and that where we are connected, that we have to start there. We have to start at the beginning. As my grandmother used to say, you have to make right from the beginning. As a clergy person, we have access to people in our congregation, and it was a shocker, I must admit. I mean, I didn't give in to the myth, but when we started experiencing people in our community being diagnosed as well as dying with a coronavirus, it's still a shock nonetheless. But yet we understand that the information was not out there, that we're behind the 8 ball. And so what I will say, that as clergy people, and I can speak on behalf of the Black Ministers Conference, is what we have been doing and we continue to do. And that's why I'm so thankful for this invitation to hear all of this information that we're going to go back and disseminate even more, is that I found that one of the things that's important, because we do wear stress heavy as a people. African American people wear stress heavy, right? And so because Dr. Crowell brought up the stress factor, as a clergy person, we're doing more than just trying to give people what they need. We're connecting with different organizations to make sure food is disseminated and is available to the community, that we're advertising, not just that we have food, but we're getting the word out to let people know that, listen, it affects us as well. And you have a lot of our people, as we spoke about already, have many other health issues to begin with. I've been dealing with one of my members all day today who has lupus.
Oh.
Okay, so she had coronavirus, and so she's slowly but surely coming up out of it, but now she's developing, or maybe it was already there, I don't know, because she went for some more testing today, because now they're saying she probably has leukemia. So I don't know the connection. I'm not a medical doctor, but she had lupus, then she has coronavirus, and now this, and so she's going down, and she's in a house full of children. We're talking about economic disparity. And it probably shouldn't be that many. We know that it's about 9 of them in one apartment with 2 bedrooms because they can't afford anything else. So they had to send the kids somewhere. I don't know where they sent them, and so that they wouldn't be affected. And there were 2 other people in the household that were affected as well. So from the clergy person's standpoint, our job is to educate, to get the information out. And I think for the Black Ministers Conference, we've been doing a good job at making sure the spiritual leaders who are part of the conference anyway are getting the information out to their congregants. We also provide services in particular, as well as services for people's emotional and spiritual health to help them with the stress as well. You have Reverend Caseman, he's constantly doing the town halls, to give out information and to also establish areas where people can go to talk, to call people, finding out where help is in the midst thereof. Because even when people are able to get their hands on food, their mental energy is not there. People are stressed. Some have gone into depression. And so these are the things we already know affects us. So I will say this, that the churches around are doing a wonderful job, I think, with the best of their ability at partnering with Manna Food and places like that to give food out. In fact, we have churches giving out food tomorrow. It'll be Saturday and all of that. I have a list. I can forward that. Yes,
okay.
Food is very important. Yes.
Thank you. We have quite a few questions coming in. I have one more that I want to ask just before we get to our chat box questions. And it really is, I'll open it up to whoever wants to take this one. It really is around how we protect ourselves. We've heard the hand washing and other precautions to protect ourselves from COVID-19. But as we know, many of the people who are now essential are Black and brown people, right? People who are postmen, delivery drivers, cashiers. And so I'm wondering if you guys could give those folks and the folks who live with them and love them advice about how they should re-enter their homes, how they can protect their families as best they can once they have come back after being on the front lines.
I'm happy to take that on. So,
thank you, Dr. Benjamin.
Globally, obviously, everybody, we got to think about how you get the virus. 3 ways. Obviously, someone coughs, sneezes in your vicinity, usually within 6 feet of you. That's for sure. And they have, of course, to be infected. Now, the challenge is that some of those folks can be infectious before they have symptoms and before they know. Second way is we now know that some of the particles that come out of your mouth when you cough or sneeze or even talk real loud or hard are small enough, particularly in an environment where there's air conditioning or fan, they aerosolize, meaning that they can go across the room and you can get infected that way. And the third way is, someone contaminates their hand, usually by coughing on it, and then they touch the doorknob, and then shortly afterwards, you come back and you touch that doorknob. It could be a table, it could be a doorknob, it could be a counter. And then, of course, you touch your eyes, your nose, your mouth, and you infect yourself through that process. So think about what the protections are. Obviously, we're encouraging everyone to wash their hands frequently, 20 seconds. Most of us do it, but we often don't do it well enough or long enough. Covering up your nose and mouth when you cough or sneeze. The original recommendation was only people who were infectious should wear the mask, and also healthcare providers. And that was because we thought early on there wasn't aerosolization, meaning that you wear the mask to protect others from you if you're infected, right? So if you cough and sneeze, it goes into the mask and not to the other person. Mm-hmm. But now we know a lot more about that. And so wearing that mask provides some degree of protection from someone who might cough or sneeze, or particularly those people that are infectious but don't know it, and may be within your perimeter. The 6 foot, the physical distancing, and I call it physical distancing, not social distancing, although I screw up every now and then, because we want to make sure people are physically distant but socially cohesive. We want them to hang out and talk to one another, engage in one another, even if it's doing some FaceTime. So when you're out on the bus, you want to try to stay away from other folks. The 6 feet is a good way to do that. We are encouraging people to wear their mask in public. I'll come back to that in a minute, because masking while Black continues to be a problem. And think about it when you go to the grocery store. So you're going to the grocery store, you want to certainly, if you can, wipe down the cart. I know the grocery stores are doing that. Go into, staying around so you're not crowded. Go to aisles that are not crowded. Stay 6 feet behind the person in front of you when you're getting to the checkout line, and try to have as minimal contact as you can with the clerk, because you want to protect them from you. Even if you don't think you're sick, you want to provide them that common courtesy. And if you're working as a clerk or a bus driver, we've done some things to try to make the bus drivers more safe. So letting them people come in through the back door, as an example. Having them, particularly for those free ride buses, where you don't have to exchange any kind of fee or anything. Most of the grocery stores and pharmacies have now put up a pane. They're having their workers wear a mask. They're having their workers wear gloves. I encourage the employers to also allow those workers to have some time to go wash their hands. Take those gloves off, wash their hands, and get a break, more frequent breaks, because when you're tired, you make more mistakes. And people have actually sat down and studied how many times we touch our faces and our hand with our hands. It's a lot. So trying to tell people to be more conscious about that is important, but we all get tired and we all fail. So giving people more breaks to do that, I think that's important. I think finally, obviously if you have symptoms, cough, sore throat, fever, muscle aches, chills, at this time, it is very likely just some other virus, but it could be COVID. And so you should talk to your healthcare provider. If you don't have a healthcare provider, today is the day you ought to figure out how you get linked to somebody. Don't wait till you get sick. Do that now. The emergency department is not the place for you to get your care, your initial care. We want you to have a number to call, whether it is one of the many community clinics we have in town. You ought to think about what happens if I get sick today, and I want you to do that today.
Thank you for that. That is great advice. Great advice, Dr. Benjamin. Thank you so much. We have a few.
I wish we had a hotline, Dr. Gale. So,
oh, don't start it, council member.
It's coming. It's coming.
We'll get to that.
Didn't we used to have one?
Don't see.
We're working on it. We're working
see,
on it.
I go back to the HIV/AIDS days. Yeah. Dr. Gales know what I'm talking about. So does Dr. Crow.
So there are a couple questions in the chat box I want to address. Delegate Pam Queen is on the line. Thank you for joining us, Delegate Queen. And she wants to know about the county's efforts in the 3 zip codes that have been reported to have the highest numbers of COVID positive cases. And I also have another question that's related and talking about where residents can get free testing and free, be seen for free, as well as, I guess, free analysis of their tests. So Dr. Gales, I'm gonna ask you to speak to both of those.
Sure. So when we found out, or when the data was released by the governor in his tweet a couple of weeks ago, that caused alarm in communities to say, oh, you know, I live in that zip code, what does that mean? And we did spend a fair amount of time trying to educate folks what those numbers meant in terms of rates, and, you know, what that means in terms of population. Because in addition to the raw numbers, you know, the 172 cases, I think it was 172, 148, and 152, they didn't talk about the population. So for example, those zip codes are 3 of the most populous zip codes in the state. In fact, 20906 has 70,000 residents, which is more than probably half the counties in Maryland. And so it's important to, when we report numbers, report them in the full context. Now, that doesn't change our level of concern in terms of those numbers, but just want people to understand you're talking about that number of cases spread out over a very large number of folks. Now, with that in mind, since then, what we have been working on is looking at the data to understand a couple of factors. One, are there any particular things happening in those zip codes that are increasing likelihood for transmission amongst its residents? Do we have a high number of folks who may be living in homes where there are a large number of residents that makes it more difficult to self-quarantine and self-isolate? You know, what other factors may be happening in those communities to drive this? So from a data and surveillance perspective, we're trying to understand those factors so that we can better tailor any particular interventions that go to those zip codes and scale them up to other zip codes across the county. Now, part of that is we've talked a lot about testing capacity. So when we look at the numbers, we know that the numbers don't actually show the true denominator of how many cases are in the community because we aren't doing large-scale testing. And in some cases, folks are either staying at home or being advised to stay at home if they have highly suspicious symptoms and cases. Now, so one of the strategies that we are working on is to Councilmember Rice and Jawando's point earlier, is to increase testing capacity and increase access to testing. And so what we have done is created alternative sites. They're non-clinical sites that offer free testing. Not low cost, not high cost, regardless of your insurance status, they're free. The county is covering the cost. And that started at our motor vehicle emissions site in White Oak. on Tech Road, right off of Colesville Road. And that site is open on Tuesdays and Thursdays. We added an additional site that went live on Wednesday at the Wheaton Rec Center on Georgia Avenue. And then we will be adding a site on Monday at the Up County Regional Service Center in Germantown. Now, one of the big issues with COVID testing is it requires you to have a provider order the test and referral. And we recognize that that is a bottleneck for many people. Either they don't have access to a provider, they don't go to, whatever reason, they don't have access to get that referral. So what we have done is reached back, Dr. Benjamin, back to our years ago and to utilize the concept of a hotline that we're working to staff. And hoping to be able to launch next week, where folks can call the hotline, get a screen, and be triaged by a provider so they don't physically have to go in to someplace, and have the provider order the test in the system, and they would be able to go to any of the 4 or the 3 sites on the 4 days that we have. Because, as Dr. Benjamin mentioned, we want to keep the emergency rooms open for those who are sickest patients, and not to create additional burden on the healthcare system as the number of cases increase. But we want to make it more accessible in community spots in different areas. Now, we recognize that's not a perfect system. We are continuing to refine and look at how we can expand and utilize other spaces within the community. But I want folks to know we're trying. We're putting things out there and we're piloting. And in fact, the site at Wheaton and the site at Germantown will be, I believe, the first examples of health department-led test sites that aren't tied to beep stations in the state. Now, we recognize that the clinical piece is only a part of the picture. As we've talked about, there are other social determinants of health and other factors that can influence and enhance transmission. And so part of that is the communications piece, making sure that when we put out information saying, stay at home or do this or do that, it is translated by many different languages, obviously, but translated in ways that people can understand how that impacts their daily lives. And so, for example, when it was the Easter holiday, we recognize that lots of people traditionally go to church. They have large family dinners and gatherings. And so instead of just saying stay at home, it's, hey, we recognize that this is a time that you traditionally would go to a large gathering or spend time with your family. So let's think about how to do that differently this year. Let's do it virtually or do some social distancing gatherings, that kind of stuff, so that people can still have the experience, but understand what those public health directives mean in the context of that gathering. So that's the second component. Now, the third component is we are working with the state to create, well, the state has 2 teams that are coming here, and we're working to create our own local version of action teams, or they're calling them rapid response teams, that can go in and do, the state teams have an EMT and a social worker / case manager, and the version that we're working on here in the county would probably focus more on the case management piece, to be able to respond to families in crises. We've already linked one of those state teams to Impact Silver Spring, and we've linked the other team to our services to end and prevent homelessness. And the goal is to be able to respond rapidly, to assess family situations, to make sure they're linked to all of that, all of those other social determinants that we talked about. Do you have food? Is your housing situation stable? What's transportation look like? Because we know that all of those other factors, as we've talked about, can create a significant burden on a family who's facing crisis in terms of a potential diagnosis. And so we're looking to scale that up and implement that. And we're also, that would also create the opportunity to leverage the massive network of nonprofits who are doing this work on a regular basis before COVID came in, to be able to help them step up and be able to enhance the response. Figured out what we're toying with is this idea of how do we continue to provide support for families with positive diagnoses. So checking in on us every day to say, has your situation changed? You know, are more family members impacted? That kind of thing. So there's a whole host of different strategies that I know that was a long answer, but I want folks at home to understand that we are looking at it from a comprehensive angle and doing the best we can to try new strategies, to leverage the partnerships that we already have existing in the community, and to also be respectful and understand that we've got to communicate things in a way that resonates with folks, that they understand and understand why it's important to do the things that we're asking them to do.
Thank you, Dr. Gales. Just a couple follow-up, not questions, but statements. So because I'm working with Dr. Gales and Dr. Crowell in these hotlines, I know that they will have translator services or interpretive services for various languages, including Spanish, Amharic, French, and all of these services are available to undocumented folks. As long as you're residents, it really does not matter. So I wanted to clear that up.
And I would add to that, we have consulted our minority health initiatives and program to get guidance in terms of how to build the program. We've reached out to them to get volunteers because, again, we want, recognizing there's lots of diversity within the county, we want to make sure that we've got providers who understand all of those nuances that you just mentioned and are able to get people through the process seamlessly and easily.
Okay.
Could I just mention one thing briefly? I'm so glad, Doctor. Thank you for the comprehensive answer. And we want to support that in more places. I'll give you an example of this effort here. Ken Hartman, and there's a team of multicultural folks that obviously the Black, African-American, African-immigrant community are part of, to try to get this message out, right? All the things we're talking about. It's, if a tree falls in the forest and you don't know how to call the hotline and you don't have the information and you don't know where to go, it's not going to help anybody. So there's a whole ancillary effort to do that. Translation is part of it, but it's also, we need to get the information to people where they are using different types of social media. This has been helpful in the Latino community. I think we need to do some Instagram. We need to do some other stuff with influencers, for example, on Instagram that are in the young African-American community where they're checking that, where we're not in any of those networks. I'm lucky because I have some cool friends, so some of them follow me, but you know, like most of us are not, they're not on this call. And so how do we get that information? That needs to be part of our strategy too, of how we disseminate the great resources that Dr. Gales talked about. And then the second point I wanted to make is our healthcare providers. So there was a 2012 study done in Montgomery County, and this is true in a lot of places. 1 in 6 nurses and CNAs are African immigrants, okay? 1 in 6, I think it's higher than that, but that was the study in 2012. So we know from geographic patterns, many of them are concentrated in the eastern part of the county, in White Oak and Burtonsville, Briggs, Cheney. We need to, I think, have a better assessment of where these folks are living, particularly if they are by definition at a higher risk of being exposed. Are we testing them? What prevention are we taking? And so there's other things that we can do that we're trying to iterate and work together as a team to address some of the root causes of this that can at least give us a better sense of the picture. So I just wanted to mention that since we were on that topic.
Thank you, Councilmember Jawando.
Can I add to that? And
of course, Dr. Benjamin.
Heretofore, we've been doing a symptom-based strategy for testing. And I think a lot of us are talking about we now need to do a risk-based strategy, which basically means, you know, dealing with bus drivers and clerks and folks that are in high-risk categories, people that we know have chronic diseases that we have in hand, like people with venous dialysis. As a way. Now, the challenge is you have to have enough tests and you have to be able to test them frequently. But I think we need to begin thinking about that, particularly with the number of people that we know are positive. And you know, you may have seen there were at least two antibody studies done. One in Los Angeles, which said that about 4% of their population was positive, and one that was released a couple of days ago, and then the one from New York released today, which says that they had about 14% of their population overall was positive. There's a fair amount of positivity out there that we don't know about.
Thank you, Dr. Benjamin. The next question really is about mental health. As we have been dealing with COVID-19, you know, we've been talking about social isolation. Some folks may have developed anxiety or depression since we've started to kind of quarantine in place. Dr. Crowell, are there any tips or any coping mechanisms you can advise folks of in this forum that could help deal with that difficulty in this time?
So let me talk about it from two perspectives. One is sort of what all of us on this call have to deal with and how we manage ourselves, and the other one is what happens when you finally get to a point where you're feeling, you're depressed, or you're facing some other kind of acute emotional distress. I think that I divide this into body, mind, and soul, and thinking about how we deal with each of those in turn. And I'm not traipsing onto my religious community colleagues, the faith community space in the soul piece. I think there are a couple of things in terms of body. Diet and exercise are key to this. Being able to eat and maintain some kind of regular schedule, getting some kind of fitness. It doesn't matter what it is. It matters that you do something on a regular basis, that you're up and moving, because body and mind are connected. And if you keep your body moving, it'll help your mental attitude and your mental outlook. Getting adequate rest, trying to maintain a sleep rhythm and a sleep pattern, and getting the sleep that you need, and staying hydrated. Just some of the things on the body side. I do a little martial arts, but I also take walks in the morning. Sometimes when I'm on the calls with Dr. Gales in the morning, I'm actually out walking a little bit to try to keep myself moving, especially now that I'm isolated and working from home. On the mental front, I think number one for me is taking a break, time out from COVID. And I literally mean time out. Turn off the internet, turn off the telephone, turn off the news, take a break from that. After about 30 minutes of what you hear in the mornings or what you hear at night, you're not hearing anything new. You're hearing variations and spins on stories. And that level of constant feeding yourself COVID information is just going to promote anxiety and promote stress and make you worry about it more than out of proportion to what you need to be, how you need to be thinking about it. I think once you understand what you do to take care of yourself, that's useful. The other thing, television, movies, engaging families. My niece is putting together jigsaw puzzles with her boyfriend. So anything that gets you engaged with other people. My wife and I cook more together in the evenings, and so I'm relearning the joys of being back in the kitchen again after spending so much time in an office. I think reading, doing other things that take you away from that. Any kind of other focus that you can do, hobbies, that take your mind off of away from COVID, that engage your brain in something other than the exercise of COVID-19. And then the last one I think is what I'm gonna call soul in this house, in this room. Prayer and meditation are useful things to help calm your mind and center you and relax you and put you in a better frame of mind. Dr. Benjamin talked about physical distancing. There's a difference between physical distancing and isolation. And if we're not very careful, one can turn to the other. And so it's important to stay connected to people, whether it's by phone, FaceTime, whatever means you have of staying connected, that keeps you safe and keeps you socially distant physically distant from folks, so you're protected. But I think that the other one for me is Dr. Benjamin talked about common courtesy at one point, and I just want to expand on that and say that reaching out to people and engaging people and being supportive of your neighbors and keeping tabs on them is important, because the ability to give to others and help others through a hard time is beneficial to our mental health as an individual. You get dividends back from doing something for other people. So that's the general kind of sweep for all of us. At some point, there is always a possibility of the anxiety getting to be too great, the family member who's having some challenges, folks who have been in mental health treatment who are not engaged right now. A lot of private therapists, colleagues that I know in the field, are doing telehealth and telepsychology, telemental health sessions with folks. And that is certainly an option, and you can reach out. There are online services that people can reach out to. In Montgomery County, we have a hotline that people can call in and talk to someone on if they've got a particular issue they want to talk about. And I can share that number with folks. It is 301-738-2255. I can repeat that if I need to a little bit.
Yeah, please repeat that. Thank you. We'll put it in our chat.
301-738-2255. It's a hotline, and they have a chat line as well. It's EveryMind is the organization that manages that for the county. So they have a hotline and a chat line for folks who prefer to do chat as opposed to speaking on the phone. We also have the Montgomery County Crisis Center for folks who are having an acute problem or feel like they really need to either see someone or talk to someone urgently, and that is a 24-hour, 7-day-a-week hotline. And I'll give you that number as well. That is 240-777-4000. That is a gateway and a portal to mental health services that we offer across HHS and across the provider network. We still have providers who are open and doing work on a limited basis, including the county-run clinics and treatment facilities. Folks who are dealing with substance abuse issues can also call that line as well. Beyond that, I want to make sure that folks understand that Health and Human Services is still open for business. We are still open. We have closed down our walk-in service, but a lot of what we offer is online and by telephone, especially when it comes to things that are focused, that are part of the social determinants of health, and that support the social determinants of health. So emergency assistance for rent, for utilities, for Medicaid, Medicare applications. And I want to point out to folks that Obamacare has reopened enrollment, and there is still open for enrollment. So if you have not registered and signed up for Obamacare, you can do that at marylandhealthconnection.gov. It's a one-word email, but if you look for Obamacare or ACA or Affordable Care Act in Maryland, you can find a place to sign up for ACA to make sure you've got health access to both primary health care and Medicaid or Medicare if you need it at some point. So you can call in for those things as well. That is all part of a package of staying mentally healthy. There's sometimes an artificial distinction between mind and body. We've got to do all of those things to keep ourselves mentally fit as well as healthy, physically healthy.
Thank you for that. Thank you for letting us know about those resources and for the reminder to stay active and stay connected even though we're physically distant. Our time is getting near, folks. We are about 10 minutes out until we have to close. So what I'm going to do is ask for our panelists to give us just 2-minute closing statement, what they want folks to remember from our gathering here tonight, what they want folks to take back, any even words of encouragement. So if you all would do that, I'd appreciate it. And I will start with Dr. Benjamin first.
I continue to tell people this is a tough time, but we will get over this. In 1918, we had a terrible pandemic, which ravaged the whole world. It was a different time. We had less medicine understanding of health and knowledge than we have today. This may not be the last pandemic, but it is certainly one that we can get our hands around, but it's going to require some diligence.
Dr. Gales.
I think the best thing to say is, we are all collectively working very hard to get information and resources out. And I know to some, it seems that we're not moving fast enough, or we may not be as responsive in comparison to other places. But I can tell you, rest assured that we are. And we are looking to try to not only leverage the resources we have in our community, we're also trying to push forward and use this as an opportunity to create the kind of change that is needed to break down some of these systemic structures that are perpetuating this stuff. So when we're talking about housing, when we're talking about food security, when we're talking about access to care, these are things that didn't just happen overnight because COVID-19 is here. And so similarly, it is going to take a sustained set of actions to be able to create the change we need to address all of these different concerns. Certainly, we will continue to do everything in our power to address what we can do in the short term as it relates to COVID-19. But I hope that this energy is sustained and the conversation is sustained long after, and hopefully it will be sooner than later, when we are on the other side of COVID-19 and talking about those things that we were talking about before March 5th when we got our first case. Thank you.
Dr. Bonner-Tompkins.
Sure. I just think that we have the opportunity to come out of this better than when we came in. I think that we have an opportunity to really address all these structural issues that brought us to this place. And, just the recognition that some things that we presumed were off the table, the idea that we would all be sheltering in place, right? So we have a vision for what we want the society to be like, and we can actualize it if we're all working together.
Thank you. Reverend Nelson, Dr. Ford had to leave us early, and Reverend Nelson is here in her stead. Do you have a couple words for us, Reverend Nelson?
Yes, I do. I just would like to say thank you to all on the panel and all those suggestions that you've made. They've been very encouraging. Appreciate your councilmen and their efforts, as well as the medical folks. Very quickly, I just want to say, let your faith encourage you and others. We can make this happen. Thank you for this opportunity.
Thank you. All right. Councilmember Rice, you have a word for us?
Yeah, let me just say that don't assume that your council members know it all in terms of what's happening. Keep in touch with us and let us know if you're seeing things, if you're hearing things. Be that canary in the coal mine, because we can be responsive and reactive and certainly do what's there. And we're trying to be proactive as well. You heard my conversation with Dr. Gales, and we try and do that. But a lot of the things that we've put in place came from people in the community communicating to us and letting us know things they heard, things they felt, things they saw. And that's how our government's supposed to work. So please, let us work for you. Let us work with you. So when you have concerns, the whole idea about grocery stores and all the things that came about regarding that came about from people. The whole thing with rent that Councilmember Juwanda was talking about came from people. The whole thing with food, I could tell you, a family came to me and texted me or sent me a message on Twitter and said, hey, what does this mean for us in food? Because my child is on free and reduced meals. I immediately picked up the phone and called MCPS, and here we have, now we're on our third level of special appropriation going to MANA. This is community in action. Make us, stronger by making sure that your voice is heard. I've been watching and seeing some of the things that have come on chat, and I'm going to make sure that we're putting that out there. But stay in contact with us. We're all on Twitter, on Facebook, on Instagram. So look there for information. I know my office puts out a very robust resource kit guide that gives you all kinds of guidelines about all kinds of great things. I know Ken Hartman-Espada is on the phone, and he's actually translated that into multiple languages. All of this information is out there. Just connect with us and we can get that to you, and then you communicate with us as well. Thank you very much, and God bless you guys. Stay safe.
Thank you, Craig. Councilmember Juwanda.
Thank you very much. And I want to thank everyone for participating in AAHP again, Arlie for putting this on, and the whole group. To my colleague and friend, Councilmember Rice, it's great to work with you on these issues, and to all the folks, Dr. Gales, Dr. Benjamin, Dr. Crowell, Dr. Tompkins. I have an honorary doctorate from Benedict College, so I don't use it because I didn't earn it, but I went to law school instead. But a lot of doctors on the call here. I want to say two things. One, as I said earlier, let's not miss this opportunity, and I think you're hearing that from all of us. We're going to stay on this long term. And one of the things, this was a question mentioned in the chat we didn't get to, and I know as the chair of the Education Committee, Councilmember Rice, and I'm on that committee as well, I am already thinking about the students who are going to have no instruction for 9 months and go back in the fall, and what that means for the social determinants of health and their access to opportunity, and what we're going to need to do with summer school and after school programs and all these things that are going to need to be invested in so that we can make up and do our best to catch our students up. And there's things like that you need to communicate with us. And then think about what's possible. To Dr. Tompkins's, Elaine Bonner Tompkins's point, who knew we could release people from jail and not prosecute people for low-level drug offenses? Who knew that we could stabilize rents at a level temporarily in an emergency? Who knew that we could mobilize as a community and get testing sites up and get go teams and social workers in places where they're needed? Think about what we're doing as a result of this crisis, and then let's not forget that when it's over, and say that we can continue to do this. And not only we can, we should, and we must, so that we don't end up here again. And then the second thing I'll say is give yourself some grace. My wife said this to me the other day because we're just running around crazy. It is hard to deal with all the things that we're dealing with, the anxiety. We have 3 kids trying to get on digital learning. You can't do it all. Give yourself grace, and we're here to help you. And that's what I wanted to say. So thank you very much.
Dr. Crowell.
So thank you all, and thank the African American Health Program for doing this, and the panelists tonight. It has been a brilliant cast of folks that are doing this. I'm honored to be in this group, and good to see that Dr. Jawando is going to be with us for a while yet, working on this issue. I want a couple of things for me. One is that I took this job as the director of HHS in July. I was given this job and appointed to this job in July. It was not how I planned to spend my first year. I had a very different vision for what I was going to be doing, but we play the cards we're dealt. And so we are here, and I'm here with you all throughout this process and into the future. We've got a long ways to go on this. We are still in the midst of a major medical issue that is going to be with us for many months, for many weeks, and likely many months to come. So, but one of the things that I think one of our guests, I think it was Craig, said that this points out who we are and it shows us who we are. And I think that knowing who you are and where you are is important in order to figure out how you plot your course forward. We have done things in the last 8 weeks that I would have thought would have taken 10 years to do, but we have done them quickly and effectively and efficiently, which tells me that it is possible to do it when we have the will to do it. And right now I see this group as having the capacity to help us keep that will coming out of this. And as we start to rebuild and think about what we need to do to address the disparities and inequities in healthcare and in life and in our incomes, et cetera, this is a group that has to stay together and continue to drive us forward on that. We have to let council members know what we need from them. We have to let our leaders know what we need from them. And then we have to be the voice in their ear. And I'm inviting this on myself, I think, at some level probably, but we have to be there constantly advising and giving them a sense of what direction we need them to go in. So I'm hoping that this is the start of us continuing to restructure this process of restructuring how we operate and live in Montgomery County as the African diaspora. So thank you all again.
Thank you. We have 2 minutes left. Now 1 minute, Arlie. I'm sorry. I was hoping to give you a little bit more than that.
That's okay. But I want to thank everyone for joining the African American Health Program's town hall meeting tonight. I do want to say that, as Dr. Crowell said, we are open. The African American Health Program has never shut down. We are still offering our chronic diseases online. If anyone wants to learn about it or sign up for it, I need for you to go to AAHPMontgomeryCounty.org, or you can even call our office. We are still picking up and answering our phones at 240-777-1833. One other thing I do want to share with the group, Dr. Crowell had mentioned movement, and AAHP is about to launch a new movement program called Gospel, where we're going to focus on promoting exercise and physical activity as we remain physical isolated during this time. If anyone would like to learn more or get information about that particular program, you can send an email to us at aahp@montgomerycounty.gov. I do want to thank everyone once again for joining us. We hope that you have gathered and gained a lot more information about the impact of COVID-19 on the African American Black community of Montgomery County, Maryland. Thank you.
Thank you. I just want to say thank you to all the brilliant panelists. I want to thank Arlie for putting this together. I feel very encouraged as a very new Chief Equity Officer in Montgomery County to be in partnership with this crew. This has been a challenging time, but it has also been a really encouraging time for me to work with all of you. Honestly, I've probably been on the phone with all of you probably the last 4 months, at least once to twice a day. I appreciate you. I appreciate your service. It is tireless. And rest up. You know, like you said, we have a long road. Thank you guys so much. You've been great tonight. And thank you who came and hung in with us the whole time. Have a wonderful night, y'all. Stay safe. Stay healthy.
Good night, everybody. Thank you.
Good night.
Good night.
Take care.
Good night, everyone. Stay safe.
Good night.